Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Island families. We hope you enjoy this evening's edition.
Good evening and welcome to this edition of Labor Vision. My name is Jim Riley. I'll be your host tonight. We've got a very special guest tonight. Tom Coderre is a senior advisor to Governor Gina Raimondo. In this role, he is a liaison to the General Assembly and helps coordinate the state's response to the opioid crisis. Tom, it's great to have you here today.
Great to be here.
You have a long and beautiful resume and a very, very compelling story to tell. I'd like to hear your story. There may be some of our listeners, some of our watchers may not know you. They've been living under a rock or whatever, but tell us about yourself.
Well, I'm a former state senator. I served in the state senate here in Rhode Island from Pawtucket for 8 years. From 1995 to 2003. The way I got elected, Jim, this is a great story. My mother was a state representative.
Know your mother well.
So she
Wonderful
got elected.
Woman.
She got elected in 1984. I got elected in 1994. I ran on her coattails, on her good name, and was able to win a seat in the state senate when I was 25 years old. I served for 8 years. I went through some difficulties of my own, which we'll talk about, I think, in the show here. Ended up leaving the Senate in 2003. Worked in a bunch of other capacities after that, and then I got to come back when Teresa Paiva-Weed was elected Senate President, my former colleague, and I was her chief of staff for 6 legislative sessions. So I did that, and then in 2014, I got asked to go to Washington to serve in the Obama administration as a senior advisor and then chief of staff at the Substance Abuse and Mental Health Services Administration, which is one of the 11 operational divisions of the U.S. Department of Health and Human Services. So amazing opportunities I've had in my life.
And really exciting too,
Very.
Especially working in the Obama administration.
It was.
So you just returned from D.C. It's great to have you back here in Rhode Island to take this job in the governor's office. So how long you were there, and what exactly were you doing down there?
Sure, I was down there for 3.5 years, and as I mentioned, I worked at SAMHSA. SAMHSA is the division that is in charge of all the...
What is SAMHSA?
SAMHSA is Substance Abuse and Mental Health Services Administration. And they handle all the federal policies around mental health and substance use. So the block grant dollars flow through SAMHSA. A lot of the discretionary grant programs flow through SAMHSA. And we work with states, local communities, and tribes on any type of mental health or addiction-related issues. And so I did that for 2.5 years. I started out as the senior advisor to the administrator, and then when the administrator left, I ended up becoming chief of staff to the acting assistant secretary there. I got to work with the Surgeon General's office on a Surgeon General's report on alcohol, drugs, and health. I got to work up in Congress. I got to go and testify to staff and committees on a regular basis on behalf of the agency. I worked on the Comprehensive Addiction Recovery Act with Sheldon Whitehouse, Senator Whitehouse, who's been a big champion of these kinds of issues. I worked with the rest of our congressional delegation and then other champions in Congress on something called the 21st Century Cures Act, which provided $1 billion for the opioid crisis. So I had some incredible opportunities while I was there.
When you think about those wonderful years you spent down there, really an incredible job.
Yeah.
What were some of your real accomplishments?
Sure. I really consider the Surgeon General's report probably the signature accomplishment that I had when I was down there.
And what was that?
So the Surgeon General's report, we did a report with the U.S. Surgeon General, and you know that Surgeon Generals have been issuing reports for decades. The landmark smoking report that Surgeon General Luther Terry issued back in the 60s or 50s is one that a lot of people know about, and that's, and people know that Surgeon General's labels on cigarette packs, and they know that kind of stuff. Well, there had never been a Surgeon General's report on addiction in America, despite the prevalence of addiction and the negative consequences that it has had on individuals' lives, on communities, on the business, community. There's never been a report on that. So when I got down there, the administrator at the time said, we're gonna work with the Surgeon General and provide the resources to do this report. We think it's urgent. It's an urgent public health issue, and it needs more attention. So we worked with Surgeon General Vivek Murthy at the time, and who really cared about this issue and prioritized this issue in his administration. And we did a report, and the report contained 5 basic principles in it. One was around the neurobiology of addiction, to help the public understand that this is truly a brain disease, that addiction is something that needs to be treated just like any other disease. Prevention needs to be an important component of the work that we do. If we can stop something from happening before it gets out of control, it's going to be a lot less expensive and have a lot less consequences to people. Treatment is really important. I don't know if you knew this, but only 1 in 10 people that suffer from a substance use disorder gets any kind of treatment in a specialty care facility, which means 9 out of 10 don't. So we need to do a lot better job of promoting evidence-based treatment policies in this country. Another pillar of the report was recovery support, because we know that this is a chronic disease. It happens over a person's lifetime. So if they don't get the kind of support that they need over their lifetime, typically there'll be a reoccurrence of symptoms, just like with any other disease, or what people often refer to as a relapse. So if you provide people the support, like housing, jobs, educational opportunities, and psychosocial and recovery supports as well that wrap around an individual, they have a lot better chance of making it. And then there's the last pillar of the report was around health systems integration. The system that treats substance use disorders grew up outside of the traditional healthcare system, and therefore it's not integrated with primary care. And so frequently the opportunities to intervene early in people's lives, like when they go see their primary care doctor, don't exist because the type of referrals that get done, the systems are siloed. There's a lot of integration that needs to happen in that area. So this report took the best science that we have to date, and we got the experts in each of those fields to write chapters on each of those reports, each of those sections. And the report was released in November of 2016 to a lot of fanfare. We released it at a big event out in Los Angeles, California, and it's been used now by, you name it, they've used it. It's been used by schools, it's been used by medical societies, it's been used by the general public to really draw attention to the addiction crisis in America. And that's what it's called. It's called Facing Addiction in America, a Surgeon General's report on alcohol, drugs, and health. And it, in the opening letter, the Surgeon General actually says, how we deal with this issue in our country, this is a moral test for America. And I believe that.
That's a great accomplishment. Congratulations.
Thank you.
Now, we know that addiction is a huge problem in this country. We've got 10 million or so individuals. 20 million. 20 million.
20.
Well, we need to keep that, and we need to get that number a lot lower.
I'd love it to be 10. Yeah. That's
now,
the goal.
You've been very open about your experience with addiction, but tell our viewers, what it was like, how you got through it, and how you're moving forward.
Yeah, so I mean, I think like a lot of people, the first drug I ever used was alcohol, and I didn't realize it at the time, but once I started drinking, I had a tough time stopping. And then it led to me using other drugs, and it led to this downward spiral of my life. Ultimately, I ended up losing everything. I was arrested back in 2003 for possession of a controlled substance in my home city of Pawtucket. And I had a judge that, instead of coming down hard on me and putting me in the criminal justice system, he said, what you need is treatment. And so, make a long story short, I accepted that offer to go to treatment, and everything has changed for me since that day. Last week, I celebrated 15 years in recovery. So,
congratulations.
Yeah, thank you. So for me, being in long-term recovery means that I haven't used alcohol or drugs since May 15th of 2003. It also means that I've been able to create a better life for myself, my family, and my entire community, because that's what happens when we help somebody find and sustain their recovery for the long term. Today, I'm a productive member of society. I pay taxes, I vote, I do all the things that everybody else does. And my story, while impressive to me and important to me and special to me, is not unique. Because you mentioned there's 20 million people who are suffering from a substance use disorder today. Well, there's another 20 million who are in long-term recovery. So my story, while special to me, is not unique. It's the story of 20 million other Americans today.
And you've gone on to tell your story and to do the great work that you're doing.
I think it's important, Jim. Because there's a lot of negative public attitudes around addiction. People still view it as a moral weakness. There's still a lot of stigma that goes along with addiction, which means that people are ashamed to talk about it. It also means that discriminatory public policies have risen up because of that shame. So there's consequences when we just try to go off and get better all by ourselves and then don't tell anybody about it, like fade back into the woodwork. So my addiction was very public, because I was a member of the state Senate when I was going through it. When I got arrested, it was on the front page of the paper. I was in all 3 local news stations here. Former lawmaker becomes lawbreaker is a nice story for the media.
Yeah, sure.
But I have to say that the media has equally been great about covering my recovery story. And for me, I would feel really like I was doing a disservice if I didn't share that with people.
Yeah, well, that's great. And I know you do a lot of work with a lot of folks on that. One of your responsibilities is to coordinate the state's response to the opioid overdose epidemic. And how is Rhode Island doing in their response?
Well, first of all, so as you mentioned at the onset of the show, I'm new in this position. I've only been here since the end of January.
Yeah.
And so I really have to give it to the folks that have been doing this work over the last 3 years. First of all, Governor Raimondo, who prioritized this issue when she came into office in 2015. She signed an executive order.
I remember it well.
She established an overdose task force, an overdose prevention and intervention task force. She put Dr. Alexander Scott from the Department of Health and Director Becky Boss as the co-chairs of it. I have since joined them as a co-chair. And I have to tell you, in my travels, when I was down in Washington or when I was traveling around the country, Rhode Island was oftentimes held out as an example for the work that we're doing here. It's because we have a strategy and we have metrics attached to the strategy. We have a 4-point strategy around prevention, rescue, treatment, and recovery. There are goals and metrics assigned to each of those, and the governor checks up every single month. How are you doing? How are you doing on these metrics? And so we've been able to achieve some great goals. Last year, I'm happy to report, was the first year in a decade that we actually had a decrease. It was modest. It was a 4% decrease, but it's the first time we had a decrease in overdose deaths in the last decade. So that's really important news. 2017 numbers over 2016 numbers went down for the first time.
That's great. It shows that the work that you and the Raimondo administration has been doing has been successful.
Exactly.
Yeah, so it must make you feel terrific.
It really does. And I don't want to have too much of a celebration about it, because we've got new issues with drugs like fentanyl that have come on the scene in the past couple of years, which have made things a lot more difficult. That's a really powerful synthetic opioid that people are overdosing in a really quick way. So we've got to keep our eye on the ball. We've made a lot of accomplishments, a lot of work left to do.
I know that your goal is 0 opiate overdoses here, and we wish you well. There's an old baseball adage that says, it's a great day, let's play 2. Well, Tom, it's a great day here, and we want to play 2. We're going to have another show with you. We're going to have a part 2 with you, and to hear more about your story, that'll be sometime in the near future. So that's it from this edition of Labor Vision. We'll see you next time. Good evening and welcome to this edition of Labor Vision. My name is Jim Riley. I'll be your host this evening. Today we're going to talk about the Child Care Assistant Program here in Rhode Island and the important role that it plays in the lives of children and families, and recent suggestions that have been made to improve the program. My guests today are Rachel Flum from the Economic Progress Institute, the Executive Director, and Shannon Carroll from the Genesis Center. On behalf of all the folks that are watching today and myself, first of all, I want to thank you both for the great work that you do. You're a couple of really smart, sophisticated ladies who probably could have gone out and made a fortune in the private sector. Instead, you're working for these nonprofits that do just such great work. Rachel, tell us about just quickly what you do over at the Economic Progress Institute.
Sure, thank you, and thank you for having me here today, Jim.
Sure.
We at the Economic Progress Institute have a mission of improving economic security for all Rhode Islanders, and we do that both by producing research and analysis on a number of different topics. So we look at the state budget, we looked at federal priorities, and then we create a legislative platform to work to improve programs for low and moderate income Rhode Islanders.
Great work. And what about the fabulous Genesis Center?
Well, again, thank you for having us.
We're happy to be here.
Genesis Center is a community-based organization. We've been around since 1982. The genesis of Genesis was to serve Southeast Asian refugees and to teach them English while also taking care of their children in a child care center. Now, 35 years later, we have expanded to not only offer English to speakers of other languages, and we're not really with the Southeast Asian community so much anymore because demographics have shifted and we serve a primarily Latino population, but we still teach English. We have a very robust workforce development program that focuses on healthcare and culinary arts, and instead of just a learning center, we have an early childhood education center.
Fantastic. So let's start by talking about the role that child care plays in the lives of working families, in the future successes of children and the state's economy. So Rachel, let's start with you. Can you tell us about the need for child care for working families, businesses, and the state?
Sure. So, we know that Rhode Island families need childcare because we know that about 3/4 of children under the age of 6 have both of their parents in the workforce, which means that they need somewhere to go while their parents are working. So we know those parents need childcare assistance, and we also know that childcare can take up almost 1/3 of a family's budget, especially a low-income family's budget. Often one fact that we throw out is that childcare costs can be higher than tuition at a public college or university. So it is a significant portion of families' budgets, but we know they need someplace for their children to go. It's not easy to bring your 2-year-old to work with you. We also know that Rhode Island businesses need their employers to be productive.
Sure.
So they need workers who know that their kids are in safe learning environments so that they can focus on whatever their job is at the time. And then we know that the child care industry provides an important sector of the Rhode Island economy. It employs people, it buys goods and services, and it also really educates the workforce of tomorrow. So we really think of child care as a policy that affects both our current children and then the future workforce. And so it's really an important conversation to have.
Terrific. So Shannon, in your role at the Genesis Center, you work directly with the children and have seen the important role that child care plays in their later success. Can you speak a little bit about that, this sort of head start that the kids get at these centers?
Absolutely. So, I think there's been a lot of emphasis on 3rd grade reading levels, and we're doing a lot of work to get kids to improve in the K through 12 system, and sometimes I don't think the importance of that 0 to 5 age range is really focused on. But there's so much evidence, there's so much research that says a child's brain is going through so much rapid development in those stages. And I would even like to say from 0 to 3 years old. So we serve infants and toddlers, and sometimes people think, oh, well, you just have to go in and watch the baby and take care of the baby. But that's not accurate. There's so much learning. Think about how much you learned as a child and how your brain is a sponge. And so what we see in our learning center, and this is particularly, with low-income families too, where, they're both parents working and there's, not quality childcare. If a child is in a quality, consistent early learning center, They're getting exposed to all the things like the words that someone needs to develop, vocabulary, the social and emotional learning that happens, and all of this sets the foundation for, number one, success when they transition to kindergarten and then later in life. So, and at Genesis Center, we focus on a whole family approach. We have adult education and early learning in one building. And so we know that the parent's level of education can also impact how the child is learning. And so what we like about our model is that whole family approach. The mother, for example, may be taking an English class or a workforce training class in our building and working to study and setting a good example, becoming a role model, valuing education and fostering the idea that learning is very important. And so we see it make a difference.
That's terrific. Rachel, you mentioned the extraordinary cost of childcare, which is real hardship for many low-wage working parents. As you both know well, the Child Care Assistance Program, CCAP, in Rhode Island was created to help low-income households pay for the cost of the health care so that they can work and know that their children are being well cared for in a regulated setting, whether there is a center or whether it's a family home or work provider. So this is an important program, not only because it helps working families afford quality health care, but also because it serves as an important piece of the early learning framework that our youngsters need so desperately. So Rachel, can you start by telling us a little bit more about the state's Child Care Assistance Program and how your organization, EPI, Economic Progress Institute, works to improve the program?
Sure, absolutely. So Rhode Island, as in every state in the country, receives federal funds to have a child care assistance program. Here we call it CCAP. And the genesis for our Rhode Island program really began about 20 years ago at the same time as welfare reform. And the state really looked to create a program that provided that both helped welfare women who were coming off welfare to have a job that they could start, but also to create a program that allowed women who were going to work more and more often to have access to affordable childcare. And so now the program provides a subsidy for about 9,000 children whose families are earning below 185% of poverty, which is about $36,000 a year for a family of three.
Yep.
The parents need to be working 20 hours a week in order to access assistance, and the child care assistance is only for the time when the parents are working. So it's, as I'm sure Shannon will talk about, that means that it's difficult for families who want to also go to college or do extra training on top of working, because the child care program is really tied directly to working. And the families do pay a co-payment amount between $8 and $124 a week. So it's not a completely free program. What we're really seeing is that there's a crisis in the program right now because the state has not kept up their reimbursement rates. So the state pays the child care providers a certain amount to provide the care for these children. And while it used to keep pace with the market rate, so how much private pay parents are paying, we are now seeing the rates are so far below market rate that for some infant care, they're paying about 11% of the market rate. And so logically, some providers are starting to stop engage with this program, and we're concerned about that for the accessibility for families.
So Shannon, this crisis we have now with the underfunding of this extremely important program, the impact of that underfunding for child care assistance is not only felt by the families receiving subsidies, but also the child care centers and the family homes that provide the care.
As Rachel said, we are encountering a crisis in our industry right now. And although Genesis Center is a not-for-profit, we're still running like a small business. We need to have money come in so we can pay our expenses and pay our salaries. And we're not looking to make a profit, but we need to cover our expenses. And with the population we have, most of them are receiving subsidies. And so it's a set rate. And I talk to friends about this sometimes, and they're like, well, it's still, you're getting, $208 per month or per week for an infant, so that doesn't cover the cost if you have all these kids. It doesn't. There are so many expenses that go into running a child care center. There are ratios we need to maintain. There are environmental regulations. It takes a lot to keep the facility up to code. So there is so much that goes into it. And if we did not have private donations, if we weren't looking for funding in other places, we would not be able to function. And in fact, this year, we did hit a critical point where we had to close one classroom. We have 4 classrooms, and we had to close one of them so we could figure out how can we move forward and maintain this center in a cost-effective way.
I understand there are efforts to overcome that gap in the loss of that revenue. So Rachel, can you talk briefly about some bills that are coming up that hopefully will bridge that gap?
Yes, so first of all, we're very pleased that the governor in her Article 15 of the budget, the proposed budget, put in about $1.5 million to support a tiered quality rates program for infants and toddlers. So trying to really address this based on paying families, providers more based on the higher quality their program is. So that's great news, and that's a great first step. We also have Representative Diaz and Senator Crowley have legislation in that would increase the base rates for all providers and then tier them based on quality. So the higher your quality, the more reimbursement rate you get to, so that we have the top quality programs getting at that market rate. And so we would invite people to come engage with us with this. So there's going to be an event at the State House on Wednesday the 28th at 3 o'clock. We'll have families and the sponsors of the legislation speaking, and then go talk to legislators around childcare and why it's important, because we know that everybody has a childcare story, everybody with kids or grandparents and their family.
Incredibly important. And it's that head start that gives these, and the folks that work at these centers, I mean, God bless them. They don't make a lot of money.
That's right.
But they're committed to the children, and I think they do a great job. I know that my office over at Local 328, when I was there years ago, we had a child care center next door. We used to bring over extra toys and things that we collected for Christmas for our members. And it was just a delight to be in there and talk to the workers there and see the kind of work they do and what the kids get out of it. It's terrific. So where do you see us going forward? Are we going to be okay? Are we going to get out of this mess and fix this thing up so that we can afford to continue to give the good care that we give to the folks?
We hope so. I mean, I think there's a national conversation going on around this right now, and we hope that Rhode Island will invest in our youngest children and move our economy forward.
That's terrific. Well, I want to thank you again for the great work that you guys do at both at the Genesis Center and at the Economic Progress Institute. And we're looking forward to having you on again very soon.
Great.
Thank you very much.
All the best. And we'll see you next time on Labor Vision.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.